I studied medicine because I feel medicine is going to give me a better access to be able to reach out to people. We are Campus Momentum and we are taking Jesus everywhere. To be able to balance faith and health care for both volunteers and the beneficiaries here. First of all, I'm just going to begin with the volunteers as they are. You know, the stress on the trip most of the time is always very, very stressful, and most of the time we go at seasons where it's dry. So first of all, we prepare for the volunteers and as well advise them to be able to hydrate themselves and take care of themselves. And as much as maybe one or two might come down with a medical condition, we actually prepare before now. We prepare before now to know anyone with any peculiarities. Okay, we prepare before now. Then for those who are on the trip and then probably come down due to stress, weakness, or that, we lay our hands. Okay, we lay our hands, advise, and I have it. For the few, I understand, I believe that medications actually work, but I believe that in as much as we are here to minister to people, we should first of all we should minister to ourselves first. So most of the time I lay my hands first, I pray for them, and if probably maybe you are still going through that particular challenge again, okay, fine, we can go through the orthodox route and give medications, and so far so good. We've not had any complications or anything at all that God has not been able to help us. I have had some of our brethren coming to tell me, oh, I have not been able to do this. After the prayers, I was able to do that. The beneficiaries rather. It's been God all through the way. We were able to, most of the time when we come, the medications we get are not always enough because of the crowd we meet. That's the number of persons we meet on the trip. As God would help us, we are able to disburse the medications. Okay, disburse the medications with our pharmacist. We've had testimonies and happiness. Most of them are able to say, okay, in as much as we are giving the healing during the crusades and everything, they are happy that they are able to get access to these quality medications on the trip. We as volunteers, in as much as we are here for we are here to pray and also to minister the gospel, we also believe that when we lay our hands on the people, okay, lay our hands on the people, the beneficiaries, the people we are coming to see, God will heal them. And so far so good. It's been amazing. We've had people with pains, chronic pain, get healed, and of course it's not just medical, those in the medical field, okay, everyone on the trip has been able to lay hands on people, and we have seen tremendous healing take place instantly. So we do not just depend on the orthodox medication. Yes, that's available. We believe that God has sent us also to bring hope to the sick. So we do that, and God has been faithful. We've seen through the days we have crusades. I remember sometimes a few years back, just by ministering alone, a woman who had been crippled for more than 10 years because she had consistently lost her kids, and so she was depressed and she was so crippled, and just ministering to her alone, she was able to rise up and walk, and it was an amazing thing. And that has just not been the only miracle experience we've had. We've had several of miracles and healings that has happened on our trips. I know that there are times where people would come and tell us their experience. Even some of the volunteers were like, oh, they came down with this and they've had this for so long, and after they being on the trip and then participated in everything, they got healed. Most of the time, the most challenge is actually the medication, how to get quality medications, not quality and quantity. Okay, quality and quantity medication. The quantity in the sense that, we are going to a lot of persons. You want to see a crowd, because wherever it is we go to, the number of persons that come out for these medical outreach are a lot, and you would see a lot of sick persons. Financially, we were unable to get as much medications that are needed, one, and then two, we have doctors on our team, but then we need enough hands. But we need lots of hands. We have pharmacists also on our team, So sometimes being on the trip, we have a lot of persons anyways who make themselves available. We have people in other professions, we have pharmacologists, we have nurses. The challenge actually sometimes is when you see because we don't go all out there at the moment presently, because I believe in the nearest future God will help us to be able to do things like that. You see people with devastating conditions that need they need to be in a hospital, you get. But then when you lay your hands, just pray and trust God, advise them on what to do, guide them on what to do, and then you trust that everything will be fine. Those basically is just that, medications and then more hands. For those who are not in the medical field, first of all, and who want to be in the medical field, if the Lord has placed it in your heart, okay, to be able to reach out to people. I studied medicine because I feel medicine is going to give me a better access to be able to reach out to people. Okay, there are people who go out there and they get access, but then as doctors we have greater access. People come in and they see you. Yes, they are open, and doors are open, access are easily open. And I'm not saying others don't have that kind of access, but then it puts you on a better pedestal. Okay, and it's easy for you to reach these people. It's easy for you to reach these people and for them also to open up to you. So if you're out there and you want to be able to reach people, you've not you've not gone to college yet, or you've gone to college, you've studied something and you want to do something with your life and you feel that God is leading to the medical profession, of course, medical missions is it. You have good access and you reach a lot of persons. And for those who are also in the medical profession already, you can volunteer. There are missions organizations, you can come in, volunteer your service, give your service few weeks, short-term mission trips, probably maybe even a year or two. Okay, Campus Momentum does that, Pro Health does that. There are so many missions organizations that does that. Not only does it help other people, but it gives you this, it makes you fulfilled, because seeing people get healed is amazing. Seeing people you have treated get healed and get better is amazing. For them coming back to tell you thank you, even if they don't come back to tell you, just seeing someone where, oh, this person was very sick and this person, you were able to administer health to this person, this person was fine. It's amazing, it's fulfilling. I'm big on faith, and I love it when I first of all administer faith first, okay, and then maybe after I've spoken with the patient or the volunteer, the beneficiary, I administer the orthodox medication. But sometimes, mostly for the volunteers, I talk about faith and then we pray. So what brings me fulfillment and joy is after that prayers, and then someone comes to tell me, oh, I like few, but just to mention one. Her experience was, oh, she couldn't sleep. Like, since she's been on the trip, she's not been able to sleep. Whenever she sleeps, she's always taking medications to sleep at night. And I'm like, how? She was like, that's how it has been. Even before she came on the trip, she's been struggling with her sleep. And I'm like, that's not supposed to. And you know it, she knows it, because. So I have told her, okay, fine, come. I won't give you medication now, but let's pray, because I trust that God is going to help you. You're going to have sleep. And so I prayed and asked God for restorative sleep. So the next day she told me she was always having headache, not just the lack of sleep. She was always having headache and everything. So the next day she told me, oh, this is it though. I forgot to tell you that I was able to sleep. Like immediately I came, I was able to sleep, because she was complaining that she couldn't even sleep in between the day where there are breaks and all that. So she was able to sleep, and she feels so good after she woke up. Things like that actually makes me happy. Prior to the trip, okay, we are concerned about the health of every volunteers. That's why in the form we are concerned to the extent that we will ask if they have any specific challenge or not. And before coming on the trip, there are rules and regulations as to be able to make sure every volunteer is prepared, because like I said, we go to places where individuals are not used to, and sometimes due to idiosyncrasies and other things, people might fall sick, or people might just react to probably the water or the environment, and just like where we are now, we're exposed to sandfly. That's why we ask, okay, when you come with your mosquito net, you come with long socks, just to avoid those things. Okay, we talk about prevention first. So eventually, in the eventuality where we come, and then probably maybe there's one challenge or the other, probably maybe the toilet, we have issues regarding the toilet. We try as much as possible to be able to make available rather a decent place for those things to be used. And then when in camp, rules and regulations are being stated, and then like the camp commandants are in charge of making sure these rules are adhered to, so that, because if one person falls sick because of maybe doing one thing or the other, because of maybe just like now where we are now, probably someone just comes, the volunteer goes around, probably maybe uses the toilet anyhow. There are things that are put in place, there are rules that are put in place, there are people who are watching, and there are people who are out there to clean and make sure people's health are safe. And the rules, like regarding those who have upper respiratory tract infection, or who are allergic, who have hay fever because of the dust and everything, we make sure the nose masks and probably maybe goggles are being worn, protective clothing are being worn, to make sure that these things are prevented. In the events where these things, maybe they fall ill or we have complications, we are able to give them medications for them to feel better. We are Campus Momentum, and we are taking Jesus everywhere.